Hi, my name's Lisa Kay, and most of you might know me from Radio Mankato, but I'm also a parent and a member of the greater Mankato community. I do have with me today Joni Stoddard. Joni, can you tell us a little bit about yourself?
Thank you, Lisa. I am a licensed independent clinical social worker. I work at the Mankato Clinic in the psychology department. I work with children ages 6 through adulthood.
And this might be a little bit of a sensitive topic for some people, but we're going to talk about self-harm today. Can you tell me what self-harm is?
Self-harm is where someone is hurting themselves on purpose. And probably the most common method that a lot of people are aware of is through the form of cutting. However, it can also be caused by burns, pulling at hair, picking at wounds, and self-harm over time can also lead to extreme injuries, such as scarring. Additionally, banging or punching objects like a wall is common, and always drinking alcohol or using drugs while hurting yourself increases the risk of that severe injury. It's often a sign of emotional distress for the individual, it's a coping mechanism, and it's a behavior, not a mental illness.
Thanks for describing that. Can you tell me what self-harm might look or feel like?
Self-harm often starts to occur in the teenage and the young adult years. The urge to harm may start with overwhelming anger, frustration, or pain. Self-harm to that person can be a release who's not sure how to handle these emotions, which are very intense, or they may have learned to hide their emotions as a self-protective mechanism. Self-harm also, oddly enough, stimulates endorphins and releases pain-killing hormones to raise the mood temporarily. If the person doesn't feel many emotions, pain might make them feel like something's real. It can replace emotional numbness, and after injuring, the person may feel shame and guilt. It really becomes a cycle of shame that's centered around intense negative feelings, and then self-harm, shame, and it repeats itself. And it can also become very ritualistic, in which the time spent doing the behaviors, patterns becomes more and more.
And now that I understand a little bit more about it, why do people self-harm?
Very good question. It can be a very difficult thing to understand. It is a coping mechanism, a self-regulation tool for many, and it often is a result of trauma, neglect, abuse, unstable family life, or patterns. People who binge drink or do drugs are also at greater risk.
As a parent, are there any signs that we can look for in our own children or maybe our children's friends that might alert us to self-harming behavior?
One of the first signs you might see is frequent bruises or bandages. Children are often known to skip class to go ahead and change bandages. Also, there can be statements that sound hopeless, worthless. There might be poor impulse control in the child, and then they might be skipping events, avoiding things to hide the scars.
So can you tell me if self-harm is in any way linked to suicide or suicidal thoughts?
I can see why a lot of people would think that it would be. However, interestingly enough, self-harm isn't the same thing as attempting suicide. They are two very different things. Self-harm is more of a symptom of emotional pain that should be taken seriously. It can lead to increased risk of suicidal ideation and tendencies, but I do want to be very clear that they are two separate things. And a lot of times when working with children, the parent will automatically become very upset and scared and nervous, and understandably so, but I really have to work on helping them educate what this is about and how to support it appropriately.
And Joni, what's your advice for parents if we find that our child or a friend of our child has been self-harming?
Good question. I know that that can be very scary, and I do encourage parents to take a moment for themselves, to breathe, collect themselves before they go and they approach their child. But then really settling into asking them how they're doing, and if you notice injuries, let them know in a caring and attuned fashion. Be prepared to listen to the answer, even if it makes you uncomfortable. Let them know, of course, that you're there to help. Encourage treatment. Doctors and therapists have gotten a lot better at being able to support this symptom. Offer to help find treatment. Don't dismiss the emotions or try to make a joke out of it to make yourself feel a little less stressed about it. And then don't make the person promise to stop. It's often a very ingrained deep behavior that has a lot of internal conflict associated with it, and it takes more than willpower. And It will just lead to feelings of frustration and disappointment for all parties involved if and when they can't maintain that promise.
And so how do we keep them safe?
I would recommend asking them to talk to you or someone they trust the next time they feel the urge to self-harm. If they are in immediate danger or you suspect suicide, call the Horizon Homes South Central Crisis Line, and that telephone number is 1-877-399-3040. And then they can also use that crisis line if they feel the urge to self-harm, if they would need that additional support of somebody to just be there until that urge or sensation passes.
That phone number would be good to have on hand, but can you tell us a little bit about what you would do to treat somebody who you find is self-harming?
It depends upon the underlying mental illness, but we do know that medications such as antidepressants may help. That combined with therapy to address emotions, learn new behaviors, as well as to provide that safe space for that person to explore that internal conflict that they may be experiencing is essential.
Well, this is a very hard topic to cover, so thank you for doing that. And do you have any words of encouragement for parents that are listening?
You're not alone, and it can feel like some very dark times at this point in time, but it is also one of the best times to be involved in mental health, and there is support and help, and I encourage you to continue to reach out.
Thank you so much, Joni.
You're welcome. Thank you for having me.